Good afternoon, everyone, and welcome to Nuclear Intelligence in 30 Minutes, a series of informational webinars about nuclear power for New York State legislators and staff members. I'm Doug Wood. I'm the Associate Director of Grassroots Environmental Education, and we are proud to host these informational webinars in coordination with New York State Senator Kevin Parker and Assemblymember Joanne Simon. And now it's my pleasure to introduce Professor Petros Koutrakis, the Akira Yamaguchi Professor of Environmental Health and Human Habitation at Harvard's T.H. Chan School of Public Health. Dr. Koutrakis' research focuses on human exposure assessment, ambient and indoor air pollution, environmental analytical chemistry, and environmental radioactivity. He's developed innovative exposure methods and sampling techniques and has led many ambient and indoor quality studies in the U.S. and abroad. For more than 30 years, Dr. Koutrakis has directed the Environmental Chemistry Laboratory at T.H. Chan and has also served as Director of the Exposure Epidemiology and Risk Program of the Environmental Health Department and Director of the Harvard EPA Center on Air Pollution and Health Effects. In 2018, Dr. Koutrakis received the Excellence in Exposure Science Award from the International Society of Exposure Science. He has co-authored over 650 peer-reviewed publications and obtained 11 U.S. patents. It is an honor to introduce Dr. Petros Koutrakis.
Thanks for the introduction. So over the last 3 to 4 years, our team tried to understand the effects of nuclear power on U.S. population. And one of the first study we did was to examine the effects of nuclear energy in the population, on the population of Massachusetts, and specifically cancer incidence. Massachusetts is an ideal state to study these effects because it is affected by several nuclear power plants which are within the state and around the state. And also Massachusetts has one of the best cancer registries in the country. And we found that the living near a nuclear power plant has an effect. And we study the effects by age group. And as you can see, for ages 55 to 64, 65 to 74, and 75 plus, we find associations for both men and women. Then we study the effects of nuclear energy on US population between 2000 and 2018. We study about the effects of over 100 nuclear power plants, and we use as an exposure metric the inverse distance of a county from one or more nuclear power plants. And here is what we find. This paper was published in Nature Communications last January. We find effects for most ages, and also we analyze the effects by gender and by age group.
Thank you, Dr. Koutrakis, for that presentation.
The distance
I must admit it's a little bit scary to think about. And you can see once you thank you for your work and the work of your team.
The risks increase dramatically, and they can be up to 20% or 10% over the general population. We also study the effects on mortality from lung cancer, colon cancer, and breast cancer only for women. And again, we found effects for most ages over 55. And also, we found small differences between men and women. And this is in press or just published by the Journal of Exposure Science and Epidemiology. We are working on several other effects on Alzheimer's, dementia, and Parkinson's, prostate cancer and pancreatic cancer, and one of them has been already submitted for publication. Now, you saw that the risks increase as you go closely to a nuclear power plant. But you also need to know that there is a large number of citizens that they live near a power plant in the United States, especially in the East Coast, where we have many power plants near highly populated areas. And you see here that almost over 50 million Americans live within 25 kilometers from a nuclear power plant. So that's pretty considerable. When we talk about radiation exposure, we talk about cancer. But as I showed earlier, we find neurological effects, and we find effects on total mortality. And we have a paper which is under second review in the European Journal of Epidemiology, where we found effects on female and male for ages over 45. And we did a risk assessment where we found that over 360,000 deaths in United States can be attributed to nuclear power, and this is between the period of 2000 and 2018. For the total cancer mortality, the total death number attributed to nuclear energy was about 120,000. So what we see here is that not all mortality is related to cancer, but there are other kinds of effects that can, organs that can be affected by nuclear energy. So one of the arguments we have is that, nuclear power represents a small fraction of the total radiation exposure. And actually, the claims of the industry are that the radiation exposure near a nuclear power plant does not exceed 10% the background radiation. And also, the regulations are based on millisievert exposure, but for external dose. So these are like gamma radiation that reaches the outside of our human body and can penetrate inside. For our studies, and based on previous research we have done, we believe that it's not the external dose, but it's the internal dose. Radionuclides, which are emitted in the environment, in this specific case for nuclear power plants, they can be transported by air, through stack emissions, or can settle in the local environment and be resuspended, and we can be exposed to them by ingestion or inhalation. So our theory is that it's not the external dose, which are mostly used for regulations, but it's the presence of radionuclides that they can enter the human body. And these radionuclides, they emit alpha radiation, which is very toxic. It's 20 times more the biological effectiveness of gamma radiation. So this is a hypothesis we're working on, and we hope to publish soon in this area. And one piece of evidence we have for this is a study we did near the Plymouth Pilgrim power plant in Massachusetts, and which is a problematic power plant. Finally, was decommissioned, stopped operating in 2019, and we study indoor dust inside homes and in the soil in 2023, and this is like 4 years after the power plant ceased to operate. And we found that uranium-235, thorium, lead-210, and cesium-137, they were present in both the indoor dust and outside soil. And this is kind of an indication that internal dose can be significant. And we really need to start thinking about alternative ways to assess exposures to nuclear power plants. And thank you very much. And I will be happy to answer questions whenever you have the opportunity.
Thank you, Dr. Koutrakis, for that presentation. I must admit it's a little bit scary to think about, but thank you for your work and the work of your team. And now it's my pleasure to introduce Ann Rabe. Ann has over 40 years of experience as a lobbyist, advocate, organizer, and educator, including as Environmental Policy Director for NYPIRG, National Environmental Health Campaign Director at the Center for Health, Environment, and Justice, Executive Director of Citizens Environmental Coalition, Executive Director at the New York Environmental Institute, and she was a senior legislative aide to a former Assembly Health Committee Chair Richard Gottfried. She's the co-founder of Don't Waste New York and the New York State Labor and Environment Network, and recipient of 13 awards for her tireless efforts, and is coordinating the Alliance for Nuclear Free New York, a statewide campaign. It's my pleasure to introduce Ann Rabe.
So I just wanted to mention, in terms of a New York perspective on the kinds of environmental health investigations that Harvard has done, that in 2018, community concerned about NL Industries worked with the New York State Department of Health to do what's called biomonitoring studies for people, both workers and residents who live next to the national-led, the NL Industries uranium munitions factory in a suburb outside of Albany. In that case, the residents have been exposed for at least 10 years to high levels of uranium, as well as the workers, and from 1958 to 1982. And what was discovered with the urine programs, which the Department of Health did, was that people 31 years after breathing in depleted uranium and enriched uranium from the incinerator stack emissions and from the worker exposure scenarios, they were still excreting uranium in their urine. And it deposits, is a radioactive hotspot in their lungs, goes to the bones, and then leaches out into the urine. So these biomonitoring studies can help people take preventative, precautionary medical care. In this case, depleted uranium is the target organ is the kidney. So people there who found that they had this in their body could have annual kidney function tests. So this is something that should be on the table in relation to the 7 reactor communities in New York State. And based on Harvard's various landmark studies, the legislative task force that the Nuclear Moratorium Act would establish should look into recommending these kinds of studies being done. People have a right to know if they've been exposed, if they're still carrying any kind of toxic load in their body. That was a case at NL Industries, and we believe that it should be investigated at the 7 reactor communities. Thank you.
Thanks, Ann, and my apologies for not being able to introduce you. Operator error over here, which happens sometimes. Dr. Koutrakis, so I have a couple of questions for you. One of the questions that I had was nuclear power plants obviously can contaminate both air and water. Do you have any data, or have you looked at which of those two things might be more important in your findings?
I don't do water. I know the Woods Hole researchers, they have found radionuclides in the water in the Cape Cod area. And also they have found in shellfish. So in terms of the ambient concentrations, there is very little. There are a few studies here and there. Also, something to keep in mind that many of these radionuclide exposures come from accidental emissions, and I'm not talking about major accidents, I'm just talking about actually I should not say accidental, episodic emissions. For instance, when they refuel the power plants every 18 months, they open up the reactor and these things can be released, contaminate the environment. Unfortunately, we have not done much research in this area. And I must say that most of the work I have done with my team is not funded. It's just with students here and there taking data which are already collected. It's been problematic. I don't think the national institutes want to, or to support this kind of studies, or I shouldn't say won't. They have not expressed interest in supporting these studies. So it's been problematic, but we are using data from Centers of Disease Control. We use data from the Radiation Network in the United States. We just got a grant from the Senate's Appropriation Committee to study biomarkers around the Pilgrim Power Plant. This was done by it was supported by Senator Markey's office. So we hope there are many things we need to do. We need to do biomarker work, enhance monitoring. But I think in terms of the epidemiology, we really have several papers indicating there is risks in ecological studies. And we are also having 2 papers under review now for longitudinal cohort studies. So I think the epidemiology is starting to become very solid. So we really need to solve, on one hand, the exposure, as we mentioned, and on the other hand, the biological plausibility. And we are working on that right now, where we show effects of exposures on blood pressure, on lung function, on inflammatory markers, et cetera, et cetera. And these studies hopefully will appear in the next couple of years.
We have a question from someone says, I live 7 miles from a nuclear power plant. In your study, did you measure radiation levels at various distances and when the level reaches normal background level?
As I said, I think we are looking into the wrong place with measuring radiation, gamma radiation, which we don't think that it is really the exposure metric that should be of interest. As I said, we want to measure radionuclides and biomarkers, but I think based on the results we have, living 7 kilometers or even miles away from a nuclear power plant, it's quite serious.
Yeah. Another question from one of our participants. The error bars didn't seem to indicate significant differences. Was I missing something? It's been a while since I did statistical analysis.
Yeah. There is like the error bars for different ages. Although they show a trend, they were not statistically significant, different, but they were statistically significant, different than the 0, than the 1 risk. So definitely there is a risk, and but the difference, I mean, the different groups were not statistically different. Correct.
Have you found any correlation between radioactive exposure with lower income and underfunded communities?
Um, uh, we actually did some analysis, and we did not find that the exposures are higher for the poorer people in the United States. We have been criticized that this might be effects because people who live near power plants are poor. We control for many socioeconomic variables. And as I said, when we do this kind of cumulative exposure versus population, we don't really see, there are many affluent communities around nuclear power plants. So I don't think this should be considered as an effect related to low socioeconomic status.
Mm-hmm. Do you expect the Nuclear Regulatory Agency at some point to begin to look at the internal exposures that you're highlighting in your studies?
I don't know what they will do. I know we have been attacked very badly from the industry. We have received over thousands of emails. Many of them are quite vicious. I don't know if the government wants to dig into this more in depth. And I think, I don't know how seriously, the problem with the radiation physicists and the radiation epidemiologists is that they used to this kind of exposure, external exposure. Mm-hmm. And I think that they are trained in this area. So it will be very hard for them to agree that, it's the internal dose that causes the problems. And I think we really need more evidence from biomarkers, as Anne said, more human. Another analysis we're going to do is baby teeth for babies living near power plants. So it's up to us to demonstrate the importance of this hypothesis.
Do you feel like the New York State government should do similar studies at the 7 reactors in New York State?
I think, considering the epidemiological results, I think we really need to take very seriously this environmental risk, public health risk, which is quite severe. I think we really, as I said, the two things that we need to do: better understand biological mechanisms and better understand exposure. And also, there is this understanding that radiation causes cancer. What we find is radiation causes more than cancer, these radionuclides actually,
Mhm.
and unmentioned kidney diseases. We see a lot of neurological effects, Alzheimer's, Parkinson's. So I think this is just the beginning of a very interesting research undertaking, and I hope foundations, the government, states, universities, they engage in this kind of research, because I think we'll learn a lot for the years to come.
If you got a call from the National Institutes of Health that said, we're very interested in your work, here's $10 million, what would you do? What kind of study do you think should be done?
Yes, I would love if that happens, because, as I said, it's been a struggle. I said I think we need to find some large US cohorts and trying to understand longitudinally the effects at different ages. Some preliminary analysis we are doing shows that perinatal exposures are important. So we would like to try to understand the effects of nuclear energy on the national birth cohort. There is a national birth cohort of 100,000 kids. Also, we would like to understand better the neurological effects. We are starting to do some laboratory studies where we expose neuron cells to alpha particles. And there is so much to do. I really think that we're just scratching the surface about this. And again, there are so many biological mechanisms, exposure, longitudinal analysis, effects on elderly, effects on kids, perinatal exposures. We find some mortality due to preterm births. We find effects on gestational period. All these are unpublished, but it's just there is so much to do.
Yeah, I hear you.
And just another follow-up question, if I could, Doug.
Sure, of course.
What about looking into the food chain contamination, such as wildlife near reactor communities? I know that the Department of Health does annual testing of fish, deer, and the milk of dairy cows. But in terms of wildlife, or looking at those records over time.
Mm-hmm.
Is that
And there is legacy contamination. I mean, what we saw from Pilgrim is that 4 years after the plant was shut down, there is legacy pollution that exists. So even if we stop now, I think we have a lot of contamination in the environment.
that needs to be cleaned up, needs to be
Mhm.
remediated? Yes, thank you.
I noticed on one of your slides that the exposure from Chernobyl was very, and I assume this is according to authorities, was very small. And yet we know it's had a tremendous impact on the population in and around the area where the accident happened.
Exactly. And the other thing is that what they find there, that 40 years, 1986, yeah, about 40 years, they are starting to see the solid cancers now. And one of the issues we try to discuss in our papers is the gestation period, how long it takes to develop cancers. And although we know, for instance, leukemia and thyroid cancer and multiple myeloma, it's something you see 1 or 2 years after the exposure. What we're learning from our studies is that, like cancer, lung cancer, breast cancer, it takes 10 to 15 to 20 years. And actually, in a study we have under review now from the UK Biobank, we find that after 10 years, you start finding effects. So maybe many of the earlier studies that people did where they did not find effects might be to the fact that it takes time. Like, smoking, you don't get cancer the first day. It takes 30 years. So that's something we need to understand. the difference between the internal dose, it takes many years to develop, whereas if you have a huge external dose, you might have cancer in a few years. So the route of exposure is so important for the biological effect.
Yeah, absolutely. We are coming to the end of our 30 minutes. I want to thank everyone who tuned in today, and to let you know, a copy, the video of this event will be up on our website, which is nynuclearmoratorium.org. And also, Ann, I'll make sure that you get your copy so that you can share it with the legislators in Albany. Dr. Petros Koutrakis, thank you so much for joining us today and
My
for
pleasure. Good to
your
see
work.
you.
We really appreciate all that you have done. And Rabe, thank you for all you have done. That's also very much appreciated. Thank you all who attended. Have a good rest of the afternoon.
Thank you.